Hello, everyone. One of the most important things that I assess my patients for is the presence, assessing them for the presence of mold toxicity or mold illness. This is something that has slipped past the radars of many of the clinicians that my patients have seen over the years. A lot of the patients I work with, they have seen many different physicians, they're general practitioner specialists, other naturopathic doctors, functional medicine doctors, and certainly not in all the cases, but in many of these cases over the years where patients, they're seeing lots and lots of different clinicians and they are still, having ongoing health issues, mold illness has been missed. And this is something that I think is partially because it's not on the radar of every clinician that's out there. Not everybody is mold illiterate, as they say. But then I think the other reason is that patients oftentimes are not aware that mold might be something that's impacting them, and then that's going to some extent, color the information that they give to their clinicians. And so I wanted to put this video, I decided to put this video out because I had a patient recently where just a classic example of what I'm about to describe, and I just thought, I should really do a video about this because it might be helpful for some folks to hear this. So in my intake forms, which are relatively lengthy, there's a section that says, have you ever lived or worked in a building that is water damaged, musty, or moldy? And there's like little boxes that you can check off. And sometimes patients check them off and sometimes they don't. And so when I'm taking the patient case and if I see that, they're telling me their health history that suggests that they might have a possible mold illness, there might have issues with mold illness, their symptoms might be accounted for by that. Then cross-reference the intake forms and see like, oh, they didn't check anything off. And so when I see those boxes not being checked off, it tells me there's one of two things going on. Either they genuinely don't have any history of mold exposure, or it means that they've had a history of mold exposure and they didn't think that they had. So if I think that mold illness is something that might be afoot, patients dealing with chronic fatigue, chronic pain, chronic neurological issues, they're dealing with mast cell activation syndrome symptoms, they are dealing with chronic headaches, chronic migraines, like chronic sinus issues, chronic lung issues, some combination of the above, then I'll cross-reference the form, see like, okay, nothing's checked off. Well, I'm going to ask them these questions regardless of whether that's checked off or not. And I'll usually preface it because I don't want to be, that guy who's like, oh, you don't know how to fill out an intake form. Like, of course, I'm not thinking that at all. I'm just thinking like, well, maybe they don't have mold on their radar. Maybe they're not thinking this is relevant for some reason. So I'll say to them, I'm looking at your forms here and I see that, you didn't check off anything about, water damage or mold or must or anything like that, but just want to ask you a few questions. So at any point in your life, from birth to present day, have you ever lived or worked or spent appreciable amounts of time in a building such as a home, a school, a church, a workplace, anything like that, that had any history of water damage, any flood in the basement, a leaky roof, a burst pipe behind a wall, any kind of water damage at all? And sometimes they say, no, I have not. And sometimes they say, oh yeah, there was that time that my basement flooded. And it's like, okay, now here we go. So they didn't check it off on the forms, but then they actually had flood exposure. And so if they say, regardless of whether they say yes I did or no I didn't, say okay, at any point in time in your life, from birth to present day, have you ever lived or worked or spent appreciable amounts of time in a building that had any kind of an old building smell or a damp smell or kind of a musty smell? And then see what they have to say. And sometimes like, oh yeah, like I lived in these sketchy apartments when I was going through my undergraduate degree and or whatever. Or like, oh, I worked at this really old hospital and it had like, a really musty smell in the basement, which is where my office was, where all my symptoms started when I worked there, like, whatever they might say. If they still say no to that, then I go for broke and I say, okay, have you ever lived or worked or spent appreciable amounts of time in a building at any point in your life where it had any visible mold, any mold overgrowth, and sometimes even though I've had hit nothing in the first two, they're like no water damage, no musty smell, no nothing so far. They'll say, oh yeah, like there was this, apartment that I lived in or this house that I lived in, and like, yeah, there was tons of mold in the closets and I always had to clean mold off my shoes and this and that. And sometimes they say no, but I always go through those questions with patients because sometimes, even though they've checked nothing off on the forms, when I actually ask them this in a direct head-on way, they say, "Oh yeah, there was that time." Now maybe they filled out the forms in a rush. I don't know. Like I'm not really exactly sure why this happens, but it has been so incredibly valuable to um, ask those questions directly of the patients, even if they have not checked off anything in the forms. Now, when we talk a bit further about mold, it and and so the question might be, okay, so like why didn't they check it off? Maybe they're in a rush, or maybe they just didn't think it was particularly relevant. It's like, oh yeah, there was that, you know, water damage, you know, in my child, like a patient I talked to earlier today. She's like, oh yeah, like she didn't check anything off on her forms, but then I asked like, if you had any history of, you know, water damage or, you know, flooding or anything like that. She's like, oh yeah, like my childhood home, like it burned, caught fire, and you know, the fire department came and like they were spraying it down with water. So like everything got water damage, and like I lived in that home until I was in my 20s. It's like, okay, like that's awful, and wow, that's definitely water damage. So now I'm not saying that the home was definitely, you know, moldy afterwards. It could have been remediated properly, but it certainly told me that okay, there's maybe one, and she has, you know, chronic lung issues. So it's like, okay, we probably want to look at exploring that just to see if this might be something that's on the table. Um, One of the other things that I mention to patients when I'm talking about this, so sometimes we'll, you know, we'll go through all the question marks and or all the questions rather, nothing's checked off. We'll go through those questions. They'll say no, like I've had no exposure. And so sometimes and sometimes I'll just leave it there. But if I have a suspicion, if I'm like, I just feel like there might be a mold component going on here, I'll go on to further say, you know, the reason that I'm asking about this, or the reason I was asking about this, is because your symptoms could be explained by, you know, mold illness. Mold mycotoxins can cause X, Y, or Z symptoms that you're experiencing. And I just wanted to make sure that there, you know, didn't seem to be any likely exposure, because this could be something that's affecting your system. And the reason I was asking about this, whether there's been any exposure at any time in your life, is because there is some research literature indicating that when one is exposed to appreciable amounts of mold, the mold can potentially colonize the sinuses. So even after we get out of that moldy environment, the mold could be coming along with us in our sinuses. It might not cause any symptoms until, you know, years afterwards, when our immune system is compromised for some reason, and then that's when symptoms are going to start manifesting. So when I tell them that story, then sometimes they say, okay, interesting, and then we move on. And then sometimes, and more often than you might think, even after we've gone through all the questions previously, they didn't check off the boxes, they said no exposure, blah blah blah. If I had a dime for every time that this happened, I'd be a wealthy man. They say, well, you know, yeah, there was that time that, you know, or there was that apartment that I lived in, and like, yeah, you know, then I think of it, like, yeah, the roof caved in because it was all moldy, or like, you know, actually, now that I think of it, you know, the school that I went to for my entire elementary school, you know, when I got to, you know, eighth grade or sixth grade or whenever elementary school finished in that particular jurisdiction, you know, like, yeah, they condemned it actually. Or like, oh yeah, you know, like I worked in this hospital, and like, yeah, a bunch of my, you know, and like, yeah, it was really old, and like, yeah, there's that room with that funky smell, and you know, a bunch of my coworkers, like they had to go on sick leave until they did some remediation. So like, sometimes it isn't until I give that whole spiel that then finally the, you know, the memories come back of like, oh yeah, this happened. And so yeah, it's a funny thing, and this is not something that's just isolated to my practice. Like this is something that is talked about at conferences where, you know, mold illness is discussed and whatnot. There just seems to be this, I don't know, there's just some type of, I don't want to say mental block, but there's just some type of I don't know. There's some type of block on some level that seems to really stand in the way of folks self-reporting mold exposure, or things that might be related to that. And again, they probably don't think it's relevant. It's like, oh, that happened when I was a kid, like no big deal. But like once they understand that, oh, maybe this is actually relevant to the here and now for me, then it seems to jog the memory. So I just wanted to share that, because in case you're watching this and you're like, oh my gosh, you know, I just remembered this and that, and I've been telling my functional medicine doctor that, you know, I've had no mold exposure, then, you know, this might be the wake-up call to say maybe you should mention that. I'm not saying it's relevant to every case, but it can be. So I hope this was of interest. If any one's had experience that relates to what I've talked about here, please consider posting in the comment section. Any questions, please post in the comment section. And if you don't mind taking a moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that.